Headaches are usually benign, but the ones that aren't, you can't afford to miss. Your MP Pal here. Welcome to another lesson from the track. All right, so today's segment, I want to talk about how to approach headaches in urgent care. All right, so this is a very common complaint. We see this all the time, and they're usually benign. But as far as how to approach these, okay? So with my critical care background, I've just been trained to think worst case scenario first, okay? So you think worst case and then work your way backwards. So if you approach just about everything like that, it just makes everything easier because you are already crossing things off the list mentally, okay? Those really bad ones, the ones that you really have to be worried about. Like the red flag ones, of course, subarachnoid hemorrhage, okay? So what are they gonna say? That's the thunderclap. That is the worst headache of my life, okay? Those are usually the ones that you're gonna hear. Another one is like a meningitis, are they having fever plus neck pain, okay? So again, those are quick questions you can just ask. Another thing is if they're having any neural deficits with it. Not just like blurred vision, because with migraines they can get that, but they have like numbness and tingling or weakness on one side. You don't need to be in urgent care, okay? And then the last one is like pregnancy or somebody that's immunocompromised, okay? So you can quickly go through that list very quickly and just kind of rule it out, okay? So that leaves the normal patient that we normally see, okay? So the most common types of headaches, migraine, stress-induced, which is gonna be, neck pain and things like that. Migraine is gonna be unilateral, blurred vision, light sensitivity, those kind of things there. And then just somebody who's dehydrated or just like a random kind of headache, it's just something that they're having a caffeine withdrawal, which is very common. Also something that I'm currently going through. I'm trying to cut back on my caffeine intake. So yeah, and those headaches can be pretty bad, okay? So you definitely want to ask questions like I always say, get a good history and things like that. So is this something where, are you cutting back? Have you been drinking fluids? Those kind of simple things there, all right? But the main thing with headache, treating the pain, okay? Can you help this go away? And so, the patient will present differently. Migraines are typically all kind of look alike. You may walk in the room and the lights are off and they're laid out. That's easy. That's easy before you even walk into the room. You see that? All right, cool, migraine. So again, what you can actually do in urgent care for a migraine, usually Toradol. And I've had so many patients that's all they want. They just want a Toradol shot and that will take this away, okay? So what may be involved with a headache, okay? So a lot of times you may see the blood pressure elevated. So again, this is when you're asking questions because for us, we don't know, is the blood pressure high because they have a headache because they're in pain, or do they have a headache because their blood pressure is high? So again, if you see that abnormal vital sign with it, of course, ask more questions and things like that, because while we all know high blood pressure is a silent killer, some people do get symptoms, especially if it's been high for a really long time and now they're having a headache. So again, this is probably something that we won't find out there. So you just have that conversation with them. But of course, I focus on just treating the pain, okay? So if it is more migraine, they're gonna have nausea with it. So in the urgent care, I'll do Toradol, and then I'll give them some Zofran if the nausea's right there and there, okay? Of course, in the ER, we had the migraine cocktail, which different ingredients kind of included with that. So it was either Toradol, Benadryl, Reglan. Some people get Finnegan, but that combination there usually works pretty well, plus some IV fluids. But again, that's more ER. So Toradol, Zofran, as far as in the urgent care right there in that moment, or if they just want a prescription. My go-to is Set. That medicine works great. I usually give them that and I do not see them back. I've been using it for years, it works great. Yeah, yes, it does have the barbiturates in it, and it's kind of crazy how like some pharmacies will, oh, this is a controlled substance, and they will give you a hard time as far as filling it sometimes, or they need verification. But for the most part, you should be able to write it. They do have a version with coding that I tend to stay away from that one because usually the regular one works. So I usually give them like 15 to 20 pills. Now, it's not a long-term medication where, you know, you want them to stay on it, but it does work great, okay? If you don't want to use that, another one, of course, is the triptans. Now, sumatriptan is the one that we are more familiar with. You know, they have injectable version, they have pills, but the best one, actually, I'd say that works quicker is rizatriptan. I think it comes 10 milligrams, but that one actually comes ODT. And so that one also works great as well, okay? So I've known providers that try to stay away from those, and they want to give like kind of a long-term one, like an amitriptyline or something like that. I'm not gonna start them on something like that, okay? Because that's more of a maintenance medication, but they want something right then and there, okay? So only time I'll do that is if they are already on it and it's like they just need a refill. Then I'll be like, okay, yeah, like that's fine. But just keep it simple, okay? So do your exam, you know, if everything looks good, you know, there's no red flags, right? You know, none of the scary ones that you have to worry about. Just treat the pain, prescription, and then they're done, okay? Like, that's pretty much it. So a lot of these things are not difficult if you have a framework, if you have a system. And so that's one thing, of course, if you've been watching my videos and following me along, that's what I preach, okay? Because if you have frameworks for each thing, it makes your life so much easier,